I'm CeciMoore, and I am your licensed esthetician here providing you information on skin concerns, skin issues, as well as just providing more deep information when it comes to overall skin wellness, right? All right, so today I wanted to talk about a huge conversation, or just a conversation that I have a lot, and just wanted to dive a little bit deeper on what is cystic acne, how we can focus on healing them and kind of getting the skin back to normalcy and just kind of getting rid of all of that inflammation in the skin. If you're interested in this topic, stay tuned. Cystic acne is going to be white bumps or pus-filled bumps that are filled with kind of bacteria and inflammation on the skin. So when you see cystic acne, it's going to be kind of like red bumps on the skin itself, or the acne forms with the oils of the skin and those dead skin clogging those pores. So normally if you have oily skin, and this can go through all skin types, but if you have oily skin, mostly it will clog those pores from just that oil and from those pores being open and that dead skin, and it could cause really bad and painful breakouts, and normally those are identified as cystic acne, right? Now with the breakouts, the cystic acne specifically will get into those pores, and sometimes, just depending, it will cause that inflammation, which causes the redness in the skin itself. Cystic acne is the most severe acne that there is when it comes to the skin, and this type of acne can cause scarring. So even if you're in the proper area of healing your skin and fixing it, normally 9 times out of 10, because how it is affecting the collagen of the skin, it will cause some type of scarring on the skin, which some people identify as craters, but I normally just say collagen imperfections, where you have kind of those different dimples in the skin from these breakouts. Now, another thing that can cause breakouts that I have noticed and also learned over time is, even with the actual breakouts clogging those pores. Let's say, for instance, that you have a breakout, and normally if you are a picker, or if you're someone that kind of likes to go in and try to pop the bump yourself, a lot of times if these breakouts have redness around them, you want to leave them alone. This is very important. If the breakout has redness around it, you want to leave it alone. The redness around these breakouts has bacteria in the actual breakout itself. So if you are pushing and then you notice the clear sebum or the fluid coming out of the pore itself, and that liquid will touch your skin not too far from the actual breakout that you have, and that has bacteria in it as well, which can then cause another breakout to happen in the next same area. So this is also another way that acne can spread on the face itself. If you are a picker, or if they're popping by themselves, breakout itself can start to spread around the face, just because the fluid is touching another area that will then eventually become a breakout. Our pores in our skin can build up excessive oil and dirt into our skin, which then causes pimples. Now, bacteria can get into the pores, and along with the oil and the dirt, it can trap and stay in these pores, which causes acne, which causes the breakout. And the skin itself will start to swell and have inflammation, which will start to make this breakout a more of a cystic acne because of the inflammation. And this breakout will go down into the dermis layer of the skin, and it will become infected. It will have a lump on it, and it will be cystic. So this will cause that swollen. It could possibly be painful. It's because it has reached the middle layer of the skin, which is called the dermis level, and the dermis layer of the skin, which will have the breakout. Now, cystic acne has a lot of different forms to it, but the most popular one, and cystic acne is not popular, but the most common one would be the red lumps under the skin, a painful or tender touch, oozing pus. Now, this acne can cover all different parts of our body, from our face, from our buttocks, from our chest, our neck, our shoulders, and our upper arms. Now, how can we treat the acne? Because that is the question, the $1 million question, right? How can we treat the acne? My top two, just off of the top, my top two recommendations for how we can treat acne, cystic acne, is we're going to follow or have active ingredients that is going to be so needed with trying to heal your skin or trying to clear out the bacteria from the pores. So we want to either go in with azelaic acid, which is going to help to clear the oil production and clear those bacteria out to help those pores become nice and clean. And one of my top favorite, we can never go wrong with salicylic acid. Salicylic acid is also going to help to remove the dirt and the oil and the debris off of the skin, on top of removing that dead skin, that dead layer of skin, as well as pulling and cleaning those pores out from the inflammation, from the bacteria, and kind of almost like sanitizing the pores, just giving it a real good clean. So salicylic acid is the number one active ingredient that I would suggest when it comes to cystic acne, as well as azelaic acid. Also, another one is benzoyl peroxide. This is going to help to kill out the bacteria that's laying in the skin itself, which is causing that redness. So if you do have benzoyl peroxide, you want to use that. You can put it in a toner form or even a cleanser form, but this is going to help to disinfect or sanitize those pores and clean them out, so that that inflammation can start to go away, or that bacteria, once the bacteria is cleaned out, the inflammation will start to reduce and that redness will start to go away. And then the last thing, this is very popular and which is highly prescribed in dermatologist offices, would be a retinol. A retinol is going to go and kind of slaw those dead skin cells off, which causes normally breakout because those skin cells are building up and they're clogging the pores. So your retin-A, which is aka retinol, is going to go in and kind of slaw those dead skins off. And this is really good for people that have severe cystic acne and the salicylic is just not breaking the barrier for them, or it's not doing enough. You would want to go ahead and get prescribed a retinoid from a dermatologist and start that process. So let's talk about how we can prevent cystic acne. If this is not genetics or runs in the family, or you're going through a hormonal period, if you're not just having that, which is normal, and those breakouts come, then these are different ways that we can prevent having cystic acne or having a cystic like breakout on our skin. Number one, using a foam or cleansing our skin every day, whether it's once a day or twice a day. A nice foam cleanser or just a gentle cleanser for the skin, if you don't have breakouts, will work perfect for you. Just getting that skin cleansed, just getting that oil and that dirt and debris off of the pores. Number two, apply an oil-free moisturizer. If you have oily skin, you don't want to layer your skin with more oil, which will cause clogging. So we want to do an oil-free moisturizer, which is going to help prevent the breakouts or clogging up the pores. Number three, don't sleep in makeup. I know sometimes we're tired, we're exhausted, or whatever the case may be, but if you are a makeup girly, you have to take your makeup off or your skin will have a breakout, especially if you have enlarged pores. That makeup is going to sit in overnight, and when your skin is supposed to be renewing itself, it's actually soaking up that makeup that's sitting on your face. And if that makeup, it has all types of product and ingredients in it, your skin is going to break out. You may not see it immediately, but you will see it. So remove your makeup. Number four, stop touching your face. The more you touch your face, you're not washing your hands every time you touch your face. Just stop touching your face. Number five, try to keep your hair out of your face. If that is possible, just depending on your stylist, and look at my hair. But if you can, keep your hair out of your face, wash your hands regularly. This will help with the breakouts on the skin, and especially cystic acne. Number six, if you work in a place where you're producing sweat, oil on a daily basis, or you're constantly working out, make sure that you're taking the time to give yourself a cool wash right after you're done with your shift or right after you're done with your workout. This is going to help not allow that oil to just sit in your pores until you're able to get home and shower. With diets, it can affect your skin. So if you're having a diet that's high in sugar or that's something that's high in glycemic, this may contribute to your skin breakouts as well. So these are causes of what we could do to prevent our skin from breaking out. But these are things that you can do to prevent the breakouts from increasing or just preventing breakouts from happening. Now, always understand that cystic acne is not a permanent thing. It does eventually get better. So just be patient with yourself, be patient with your skin, and know that you are not alone in this step when it comes to the cystic acne. If you invest in your skin, it will show. I definitely hope this has helped. Once again, my name is CeciMoore, and I am your esthetician. And thank you guys so much for tuning in. I will see you guys on the next video.